Okay, great, thank you. Welcome, everybody. Thank you so much for joining us for Rooting for Resilience, a discussion on benevolent childhood experiences and a guided tree of life activity. If you're joining us for the live stream, wonderful, welcome, thank you. Or if you're joining us later for the recording, also so happy to have you here. My name is Amanda Wroblewski. I coordinate the Pillar program with Boulder Community Health, and I can talk a little bit more about the program later on in the discussion. But what I want to do right now to get the evening started is, again, welcome everybody and thank you all for being here, as well as set an expectation for what we'll be discussing tonight. So we'll be talking about some probably pretty sensitive subjects for a lot of people: youth mental health, suicide, and resiliency. The expectation that I'd like to set for the evening is that none of it's going to provide an easy answer, but our hope tonight is that it provides you all in the audience with information and resources for how to support youth that you are parenting, that you work with, just that you know and love. So with that being said, we will have plenty of time for questions throughout the discussion. You can put questions, comments, discussion topics in the chat box at any time throughout the evening. We've got some audience members here as well monitoring our chat, and we'll try to answer things in a timely manner, and we'll try to get to all the questions that we can tonight. So with that, I want to do some introductions as well. So again, I'm Amanda Wroblewski. I'm a licensed clinical social worker. I currently work in the realms of substance use disorder treatment and mental health. My prior experience is in the world of HIV/AIDS direct service and pediatric cardiology, working with children and families in that setting. And
hello, welcome. My name is Mackenzie Latendra, and I work in the Healthy Youth Alliance, which is a program in the Community Services Department at Boulder County. I have a background in substance use prevention and am trained as a social worker and in public health. Quick note about tonight: if you are joining us this evening in Spanish, there should be an option on the live stream to click on the closed caption button, and then you can change your language to Spanish. And we also have a translator here with us in the audience, Marta. So if you'd like to type anything in Spanish in the chat, then she'll be able to respond to you directly in the chat.
And we did have another speaker that was planning on joining us tonight. Unfortunately, due to some unforeseen circumstances, she will not be here. Jenna Clochard, who is the executive director of the Rise Against Suicide organization in Boulder County. But she passed along her notes and information, so we will still be sharing about Rise Against Suicide, some of the statistics about youth suicide in our community, and some tools on what to look out for and how to help a youth that may be struggling. Okay, so good, I think.
Awesome, yeah. So Amanda's going to go ahead and get started with some information, and then after that, you should have received at your doorstep or on your porch a bag full of goodies. We've got a really fun activity planned for tonight that I'll be going through after we go through some information. So just have that handy, and yeah, enjoy the evening. I think it'll be a lot of fun.
Awesome. Thank you. Okay, so we are going to start the night talking about childhood experiences, both good and bad. So to preface our discussion this evening, we are going to be discussing what are called benevolent childhood experiences. But I think to give folks context before we do that, we have to back up and talk about adverse childhood experiences. And again, just in the interest of transparency, I am not an expert in ACEs or BCEs, but with my skill set, my training, the experience I've had working in the field with adults, children, families, a lot of different populations facing a lot of different struggles, I felt that I could present the information to you all and confidently share what the research has been showing us. So, that being said, starting with adverse childhood experiences, we call them ACEs in the field for short. There's a lot of acronyms in mental health and substance abuse work. So these are ACEs, and ACEs are potentially traumatic events that occur to folks between the ages of 0 to 17. What you see on your slides is just different ways that ACEs are coded when someone is being seen in a hospital or by a therapist to give one a correct diagnosis and also for like insurance reimbursement purposes. So they mirror each other pretty closely: an extremely threatening or horrific event or series of events, or exposure to death, threatened death, actual or threatened serious injury, or sexual violence. So it's a big umbrella. And something I want to offer too about trauma and traumatic events, it looks different for everybody. Trauma is anything that overwhelms our coping and, makes our brains kind of shut down and go into survival mode. So, I'm happy to, my contact info will be at the end of this portion of the slideshow, and I'm happy to send these slides to anybody who wants them. There are a couple links embedded here, and one of them is the ACEs quiz. Anybody can go online and take it. It's 10 questions that gauges things you were exposed to in your childhood or things that children may be exposed to currently to determine if they are experiencing an adverse childhood event. So ACEs have actually been studied for quite a long time at this point. The literature documents the negative effects on the developing brain because, again, trauma kind of puts our brains into a state of arrested development because it's just allowing us to survive. So some of the highlights, I guess you could say, from the research on ACEs is that they induce a response that can interrupt normal functioning. So, we always feel overactivated, we're emotional, our stress response is a lot shorter than it normally would be, and it also interrupts the part of our brain that regulates reward processing. So a lot of these characteristics are true of folks that struggle with mental health disorders as well as substance use disorders, and we can talk about that a little more as we move on. Oh, we're just, are we good? Does it look weird? Sorry. Okay. So when someone is experiencing ACEs, they are unable to successfully master certain developmental tasks. That's what I mean when I say arrested development. So they have more difficulty forming secure attachments and regulating emotion in a healthy way. Again, this is where a lot of substance use comes in to regulate emotion with unhealthy skills, namely substances, alcohol, drugs, other behavioral concerns, other behavioral addictions, sex, gambling, shopping, food, whatever is filling that hole, essentially, that wasn't met, that need wasn't met along the developmental path. So that's kind of a really high level overview of ACEs. Again, there's some more information. There's a link. Let's see. There's a link to the quiz that if you're curious, I certainly encourage you to take a look at and maybe think just about some past experiences. There's also a lecture that was done this past summer by our program in partnership with Dr. Joseph Uretzian, who does a whole hour discussion on ACEs and how those affect behavior into adulthood. And so those can give you some more information, but what this all kind of culminates into is generally a diagnosis of post-traumatic stress disorder or complex post-traumatic stress disorder, PTSD or CPTSD. And, let's see if I can actually, nope, okay. That link is not working for me just yet. But so then what are we talking about in the bigger picture of benevolent childhood experiences? Well, BCEs, another acronym, is a new scale that is used to address childhood adversity and not necessarily counteract, but to buffer, and we'll get into that in a little bit. But this research is fairly new. It's just been in the last couple years that a handful of studies have come out that show that what we call benevolent or positive childhood experiences can have just as much of an impact as the adverse ones or the negative ones. So the reason we wanted to discuss BCEs with you all today is because we're talking about resiliency. And the emerging evidence suggests that these positive early life experiences do build resiliency. And resiliency is how we cope with the negative things that happen to us in our lifetime because they're unavoidable for most people. So what are positive early childhood experiences? They are positive attachments with parents and caregivers. This is probably one of the biggest and most important experiences that children can have is positive attachment with their caregivers that starts the foundation of healthy development. Effective parenting, and that can look a lot of different ways. There's a lot of different studies that have been done about parenting over the last however many years. But there's a little more information on parenting styles. Oh, here we go. Oh, great. The links are working. I'll back up and go to some of the ACEs links as well. Can you guys all see the parenting styles on the screen? Okay, sorry, time out. Technical issue. Give us 1 second. How do I download them? Okay. Sorry, just 1 minute, folks. I don't know what's on the screen. Okay. Okay. All right. I think we're back. I think everyone can see the slides now. Apologies. I was kind of rambling without anybody having an outline of what I was talking about. So, backing up to ACEs, adverse childhood experiences. This is the quiz And I just wanted to pull it up and give everyone like a second to take a look at it. Oops, I passed it. Oh, right there. So this is what the quiz looks like. And again, if folks are interested in learning more, I encourage you, go take a look at the quiz, read the article that accompanies it. It's from NPR, and it kind of just gives food for thought, and if anyone's engaging in mental health treatment, maybe something to explore, or just definitely more information on what to know when working with youth that may have experienced ACEs. So again, happy to send the link or the slideshow to anybody who wants it, so you can have these links. And then this is what I had referred to earlier. It can be done, it can be accessed through our video library in the Pillar webpage, but it's a discussion, again, by psychiatrist Dr. Joe Uretzian, all about ACEs, how it affects people in youth and in adulthood. So there's a resource, again, just you're able to learn more. And then some more information on PTSD and complex PTSD. And I've been told that we have a question. Someone asked a question in the chat, am I correct?
That was the link to the ACEs test is in the chat.
Oh, there's not one in Spanish? Okay. Sorry, give me 1 second.
No, we put the link to the ACEs.
Okay. Okay. Sorry. This is, will you text Joe? Okay, there may be a question. We will get to it in just a second if there is. So yeah, again, just a high-level overview of ACEs, where you can go to learn a little bit more. But then again, what we're talking about here tonight are the benevolent childhood experiences, the positive childhood experiences. And again, the research on this is still emerging, but here's more information on the BCE scale. So I'll give folks a second just to read that and take a look at it. And yeah, just some quick examples of BCEs. Like I'd mentioned earlier, positive attachments with parents or caregivers, effective parenting, again, more about parenting styles, and I'll pull that up as well. So this is research that's been done for a very long time, the 4 different parenting styles and how they're categorized. You can learn more through this link. There's a little bit of a visual representation for folks. And I thought I liked this one because it is pretty straightforward about different parenting styles. But even just the little things, positive touch, so hugs, hand holding, any kind of safe touching that makes kids feel safer in their bodies, positive relationships with teachers, peers, extended family, friends, and one of the other kind of really big things with kids is predictable schedule and routines. Just predictability is one of the things that makes them feel safest. So having any of these, all of these are what we're finding counteract ACEs or other adverse childhood experiences. Any questions? No? Okay. All right. So that being said, what does the research tell us? How do we kind of summarize all this? So one of the big questions in all of the research that I looked at was, do ACEs and BCEs represent opposite ends of an experience spectrum, or do they happen in tandem alongside one another? So really they're kind of parallel things. It's not a direct cure. It's not a one-for-one, right? Like if you have one adverse childhood experience, one benevolent experience is going to cancel that out. Not quite how it works. Again, trauma shows up differently for everybody, but the things we do know is that, what I discussed previously, that childhood adversity negatively affects how we regulate emotions as adults, and that these are more highly correlated with PTSD rather than complex PTSD if benevolent childhood experiences are experienced as well. And another thing, I forgot to mention, that the research shows is symptoms of PTSD are more likely to develop in adults that have experienced multiple traumas as children or traumas over the lifespan. So please don't make one of your takeaways that a child experiences one traumatic event and they're toast as far as gonna have to live a life with PTSD or other struggles. Not true. Again, trauma showing up differently can look different as adults, but it's more exposure to multiple traumas is what we see in adults with post-traumatic stress disorder, substance use disorders, mental health concerns. So I want that to be a takeaway too. I don't want to scare anybody. But both ACEs and BCEs do contribute to a variation in long-term functioning, like I've been saying, how it shows up differently for everyone. And what I mentioned before, that BCEs are they're not a direct cure for trauma as a child, but can help buffer the effects. And they have higher potential for resilient outcomes in kids that experience benevolent experiences along with adverse ones, if that makes sense. And just kind of the overall takeaway from that is that benevolent childhood experiences promote better long-term functioning. So again, knowing that there's a safe, secure base that kids can attach to, that's going to count for a lot if they're also experiencing some traumatic things in their life at the same time. Another really big takeaway from the research I had read was that BCE should be incorporated into treatments for adults living with PTSD. So one of the emerging treatments for adults with diagnosed PTSD is recalling positive childhood experiences, looking within themselves to heal that part of the brain and remembering what those positive experiences led to and the feelings they led to, because this has been shown to counteract the pathology of a traumatized brain, which is actually really fascinating because it's been a topic of research for a very long time. And that some adversity in childhood is good. It helps us build a tolerance to stress and adversity, and namely, what we're talking about tonight too, helps us build resilience. So those healthy coping mechanisms, how we address barriers and bumps in the road when we come across them in life, having a frame of reference to do that, we want that for our kids and for the youth in our lives. So some of it's good. Again, looks different for everybody. Where that tipping point is kind of a moving target of what's enough good stress and where it turns into traumatic stress that shuts down our coping. Again, if at all possible, if adults are aware. That's the thing too, a lot of this happens in secret with kids, these traumatic experiences. But if adults are aware, then hopefully these ACEs can be followed up with benevolent childhood experiences to have that protective effect and to help build that coping and help build that resilience. So yeah, again, it's still a developing field, and there's still quite a bit of work to be done, both on ACEs and on benevolent childhood experiences. And I think, again, just one of the big takeaways should be that if kids have at least one trusted person in their lives, that's going to account for a lot of the support that they need and their needs being met. So that was kind of the rundown that I wanted to give everybody on benevolent childhood experiences, adverse childhood experiences, the introduction, and the why behind why we want to talk about resiliency tonight. Again, we were going to have a speaker share more on the state of affairs in Boulder County on youth mental health and suicide. But I'm going to go ahead and read her notes and the information. Just want to pause for 1 second, though, give folks a chance to digest that information and leave a minute for questions, potentially. Yeah, we've got a question from the audience.
Hey, so I just have a question about the relationship with the person who, say, like your family member or your mother is traumatizing you. She's causing the ACEs. Can that person also give you those good memories, or does it usually have to be like some other kind of family member or a family friend? Or?
So good question. So the question was if it is a close caregiver, like a mother, that is inflicting traumatic stress onto a child, can it be the same person also providing those benevolent experiences? Again, without being an expert in the field, and just what I know from my work as a clinician and what I've read in the research is I would lean towards no. It couldn't be the same person, because that's actually how like some personality disorders get developed, is that unknowing, there's no consistency. It's a lot too of what kids experience when they live like in a home with an alcoholic. They never know what's coming. They never know how to anticipate the next interaction, the next move. So I would say probably not, just because their brain is always in that state of hyperarousal. And if your brain never gets a chance to kind of unwind from that, there's really no space to do the healing, to allow the benevolent experience to do its job, essentially, and counteract what that traumatic experience has been. That'd be my take on it. Next question.
So in the research that you read, do you know if ACEs, is there anything that says which ACEs or BCEs is more predictive of, like, are ACEs more predictive of trauma versus BCEs being more predictive of resilience?
Yeah, good question. So, because I'm not sure if the audience can hear you guys. I know you're mic'd, but the question was, in the research that I have read, is one more predictable than the other? Like, are ACEs going to cause higher rates of PTSD, or are BCEs going to provide more of a buffer, more protection, right? Does that articulate? Okay. You know, it didn't really, nothing I read specified. Just, I think too, probably because the research is pretty new on BCEs, and it can't be quite translated to a broader population like we can do with ACEs right now, just because there's been more years of research done around it. But pulling what I can from the research, like with kind of everything else, depends. It depends on what the trauma looked like, how long it occurred for, and then what the BCEs looked like, how often those occurred? Was it predictable? Was it, were they experiencing things positively or negatively with a trusted caregiver? Because it could be both, like our other question just brought up. So I think it depends on a lot of different factors, but what the research was telling me is that one isn't more like prevalent than the other, that this like X doesn't translate exactly to Y and A doesn't equal exactly B, if that makes sense. So I think it's something that we'll definitely keep our eyes on in the field of substance use awareness, prevention, treatment, and recovery, just because there are emerging applications and recommendations for treating adults that are struggling with PTSD, namely as a result from childhood trauma. Good questions. Other ones? Audience out in TV land or YouTube land? Anybody?
What is I know it's, childhood experiences, but I mean, even as adults, if you experience something good, you feel like you still take away some part of, whatever trauma or something you're holding.
Yeah. So there was just, an observation of, even as adults, we can use positive experiences to counteract maybe something traumatic that we've been holding on to. I think as adults, it is harder just because if you experience trauma in childhood, that, it rewires your brain to categorize things a certain way, to think a certain way, to recall things a certain way. But I would agree that using positive experiences as an adult, if you're in any kind of mental health treatment therapy, doing like EMDR with a therapist, addressing substance use and the underlying causes of mental health and trauma, I think certainly using positive experiences in adulthood would be very beneficial to help counteract that traumatic pathology. Good questions, you guys. Okay. So a little more information, because our focus is youth, we wanted to highlight a local youth focused organization as well. So Rise Against Suicide is an organization here in Boulder County that helps youth at risk of suicide by removing the financial and social barriers to treatment, enabling them to find hope and healing. Rise Against Suicide funds therapy sessions for at-risk youth struggling with suicidal ideation in the geographic areas included in Boulder Valley School District and the St. Vrain Valley School District. Young people up to the age of 19 who are experiencing suicidal thoughts and are uninsured or underinsured are eligible for funded counseling services through Rise. The organization receives referrals from private and public elementary, middle, and high schools, community social workers, psychologists, and mental health professionals, hospitals, and mental health facilities. So really kind of no wrong door to get in touch with Rise. Within 24 to 72 hours of receiving a request for help, at-risk youth can be connected with qualified private therapists. This immediate response is something unique to Rise Against Suicide. Right now, we're finding that our community does not have enough beds for suicidal youth, and they are being sent home, and parents are told that they need to keep watch over their child to make sure they do not die by suicide or by sitting in waiting rooms for long hours hoping to be admitted. Suicidal youth are seen for an initial appointment at a crisis center, and then told that they will need to wait 7 to 10 weeks to see a therapist. This is unacceptable, and these youth need to be seen immediately. Rise Against Suicide received 46 referrals in the month of September and are currently averaging one referral a day in October. These are the highest number of referrals in a month since the organization began in 2009. Young people are struggling with being back in school full-time after being home all of last year. Drug and alcohol use has increased among teens and is being used as a coping mechanism. Social elements of kiddos' lives have changed dramatically. Family dynamics and relationships have changed, and it is difficult for youth struggling with their mental health to become regulated. Again, kind of harkens back to what we're talking about with adverse childhood experiences and that emotional regulation being interrupted. So Jenna wanted to share some statistics with everybody. Nationally, suicide is the second leading cause of death for youth ages 10 to 25. In Colorado, it is the leading cause of death for youth ages 10 to 19. Before the pandemic, suicide rates had already substantially been on the rise. From 2007 to 2018, youth suicide increased by 57%. Since the pandemic, suicide attempts have also dramatically increased among adolescents ages 12 to 17, especially those that identify as female. Approximately 1 out of every 15 high school students reports attempting each year. For each suicide death among young people, there are maybe as many as 1 to 200 attempts. A report shared by the Congressional Black Caucus showed that there is a growing crisis in the mental health and well-being of Black youth. The suicide death rate among Black youth is increasing faster than that of any other racial or ethnic group, with Black youth under 13 years of age being twice as likely to die by suicide as their white counterparts. LGBTQ plus youth are 4 times more likely to seriously consider suicide, make a plan, and attempt than their peers. The Trevor Project estimates that at least 1 LGBTQ youth between the ages of 13 and 24 attempts suicide every 45 seconds in the United States. And that's also something worth mentioning, is that youth of color or that identify as LGBTQ are much more vulnerable to mental health, substance use, and don't get the help that they need in higher rates than their white counterparts. Approximately 1 in 5 teens ages 12 to 18 suffer from at least one diagnosable mental health disorder. So, what does all that mean for the kids we know and love? Let's talk about warning signs. And it's a little difficult to tell some of these, I think, from just normal teenage behavior. So I'll go through these, and then if there's questions, please don't hesitate to ask, but then there will be a couple resources on the next slide. So abrupt changes in personality, giving away possessions, previous suicide attempt or attempts, multiple, use of alcohol and drugs, being withdrawn from people, especially close friends, family, and or favorite activities, change in eating and sleeping patterns, suicide notes, threats, direct, I want to die, or indirect, the world is better off without me, self-harm, death and suicidal themes in drawings, work samples, journals, or homework, and really any change in behavior should make your radar go up. So more risk factors, history of mental health disorders, low self-esteem, loss of security, so fear of peers, authority, just not feeling safe, stress due to new situations, feelings of hopelessness, failing in school or failure to pass an important exam, a breakup, ending of a relationship, major loss of a loved one, relationship, home, or divorce, chronic physical illness, access to easy lethal methods, sexual orientation that doesn't, if they don't identify with the dominant group. So again, 3 to 4 times higher risk for LGBTQ plus youth, traditionally marginalized youth, youth of color, youth of lower socioeconomic status, any of those stressors, stressful family life, having parents who are depressed or who are using substances themselves, a family history of suicide, local epidemics of suicide, isolation, or a feeling of being cut off from other people. So here's some of the tools though, and here's what you can do. Be a connector. Be alert to the possibility of suicide and connect the person to help. Really listen, active listening, asking questions, not just, being passive and waiting for your turn to talk. Staying with them until you can connect them to help. Notify adults if in the home if you aren't one of them. Your only expectation as a human is to connect. Doing nothing makes the person no safer. Be direct. I think this is one that a lot of people struggle with, not only with youth, but with adults that are expressing suicidal ideation. Ask directly, are you thinking about killing yourself? Are you thinking about suicide? And last but certainly not least, call 911, call the suicide hotline, reach out to RISE. There's help and there are resources, and there's a whole community, both for people struggling with mental illness and with substance use disorders of any age, whatever that might look like. So just a couple of resources on this slide for everybody. The website for Rise Against, and then this is my contact info. Again, I coordinate what's called the Pillar Program, and we're part of the healthcare system. We connect folks to support for substance use disorder treatment. So kind of anything falling within these realms, please reach out, let us know how we can connect you to the right supports. So that's my part of the presentation. I'm gonna, again, open it up for questions, if any have come in, if anybody's got one.
Yeah, who can refer for RISE? Does it have to be a parent, or can it be a service provider like a school counselor or a relative?
So the question was, who can make referrals to RISE? And it sounds like anybody. What Jenna had sent me about what they are, who they are as an organization, they receive referrals from elementary, middle, high schools, social workers, psychologists in the community, mental health professionals, hospitals. So it sounds like anybody working with youth that has a concern can reach out on the website and make a referral. Good question. Any others? Nope. Okay. So now we're hopefully going to change the tone a little bit, make it a little more hopeful by starting an activity called the Tree of Life that's going to be a tangible representation of resiliency and how we can support any youth in our lives with building that. So. So give us 1 second while we switch. Oh. I don't know how to pull up the...
All right, so thank you so much, Amanda, for that lovely talk about resilience. So now we're going to hopefully have some fun and, as Amanda mentioned, do an activity that will give us something tangible to represent resilience and the sources of resilience in our life. So first I'm going to talk a little bit about the activity and then go through the different aspects of the activity and give you all at home and those of you working here with us a chance to kind of brainstorm and outline what you want to do for your tree of life. So for those of you that are joining us that are working in the mental health field, this activity is actually an evidence-based activity, and it was developed using the kind of theoretical framework of narrative therapy. It was developed in 2006, and it's based on Zimbabwean folklore. One really neat thing about this activity is that it is very applicable to different cultures. So the tree of life, or the tree as kind of a life-giving body, is something that's recognized in most cultures as a metaphor. And the tree of life has lots of connotations in biology, philosophy, mythology, and religion. So it really is kind of a widespread metaphor that most people recognize. Also, it has been well researched, and it's shown positive effects when working with vulnerable Zimbabwean children and those affected with HIV. It's also been used with Vietnamese refugees, African and Caribbean men in Hackney, London, Liberian refugees in Austria, and also at an intervention in a North London school, and in Camden Heights in a population that parents had described as hard to reach. So it does have a very broad evidence base. So as we go through this tonight, if you are somebody who's working in the field or a parent, you can be thinking about how you might want to go through this activity with young people that you work with, or even with your children. And hopefully, if any parents are joining us tonight, you should have enough craft supplies for yourself and anyone in your family to do the activity with us. So, to get started, I actually made an example tree of life to show you all. And I got carried away in crafts, so what my tree of life means, I decided to put on this sparkly cloud here. And this is my tree, using all the supplies that you should have received in your bag. So I'll just kind of quickly go through what my tree represents, and then we can go through the activity together. So actually, here's another. If you're feeling less crafty, this is an example of a drawing of a tree of life. So in this metaphor, the ground represents who you want to be or who you think you are meant to be. The roots represent names of people who have taught you any cultural traditions that you practice, or anything that makes you unique. And then the trunk represents your skills and abilities. The knots represent barriers or stressors that you've overcome. Branches are your hopes and dreams. The leaves are things that you're grateful for. The fruit is gifts of wisdom or gifts of kindness that have been given to you that you can also share, like fruit is shared. The sun represents daily practices of self-compassion. And the sky, which is not something that's part of the actual tree of life, but something that I added because I was really into the blue glitter, is representing opportunities that you see in your life. So this is my tree, and I'll start at the ground. So the ground is who I want to be, and patient, kind, and supportive. So that's kind of a mix here of like the brown and green glitter. I feel like I'm made up of, I want to be lots of different things, so there's a couple different parts of that. The roots are 3D and sticking out, and there's lots of them because there are lots of people who have really impacted my life, but the people I wrote on my cloud were my mom, my dad, my grandma, my grandpa, and my aunts and uncles. Very original. The trunk is representative of skills and abilities, so I wrote empathy, compassion, creativity. Knots are things I've overcome, so I have a knot kind of at the bottom of my trunk, and then midway through I had some barriers that I overcame very early in life, and then kind of midway through my life, so that's why I put the knots there. And then the branches are kind of hard to see, but they're covered up with lots of leaves because I have lots of gratitudes. But they are the ability to further my education and have a family, and also help others through my experiences. So those are some of my hopes and dreams. All of these leaves represent the people I'm grateful for, that I have a job, that I have housing, and the opportunities that I've had in my life. And then the fruit, things that I have and that I want to share with others, are my spiritual beliefs, more just for me, not something I really want to share with others. My education, love and support, and kindness. And then the sun, my daily kind of practices are being grateful, walking daily, and eating healthy. So now we're just going to take a minute, and I'm going to go through, ask you to maybe grab a piece of construction paper that you have and a marker, and just write down an outline. And then at the end, we'll take maybe 20 or 30 minutes for you to actually build the tree. Quick, before I do that, I wanted to introduce Alyssa Amadai. And she is also works in the Healthy Youth Alliance, and she's a part of the Behavioral Health Equity Corps and an AmeriCorps Vista member. So I'm going to kind of just talk through the different supplies that you have, and Alyssa, if you want to hold them up. So we have some base to build your trunk. It's like some wood laminate-looking stickers. So you can cut that up and use that for your trunk and your branches. We also have some sticks and some brown burlap that could also be branch or trunk material. You should have glue sticks, Elmer's glue, some markers, lots and lots of glitter from the dollar store in case you want to get more glitter for anything else, and some stickers. There's flowers, butterflies. You might have birds, bees, squirrels. You have some leaves and some nice autumn leaves as well, some tissue paper, and you all should have construction paper as well. So we want to get started. So as I mentioned before, the ground is kind of the base of the tree, and this is where you'll write down your core values or the person that you believe you're meant to be, some characteristics of that person. So I'll give you just a second to go ahead and think about what you'd like to put there. In the audience, any ideas for what you're going to include in your ground?
Well, the person that I'm meant to be or want to be is just like a strong woman. I'm a mother and a son, so just being very like strong for myself and for him, and just knowing who I am. You know, just being a master of myself and not for anyone else.
Thanks for sharing. For those who weren't able to hear that, it was being a strong woman. She's a mother of a son, so really setting the example and being the master of herself.
Yeah.
Amanda, Alyssa, any ground tidbits to share?
I put dependable, kind, and honest.
Dependable, kind, honest.
Yeah, consistent, supportive, and I identify really strongly too with being a parent, so raising strong and empathetic kids.
Thanks for sharing. So the next aspect of the tree is the roots. So this is, again, names of people who have taught you in life, any cultural traditions, or anything that makes you unique. Yeah, thank you.
So my boyfriend of 9 years, he's Dominican, so just learning about his culture and being a part of it, it's amazing just the love that they have, and of course the expression through dance. Yeah, that's my root.
Thank you. That's a really fun one. Her boyfriend's Dominican, so she shared there's a lot of dance in that culture, and that has been really fun, and that's a big part of her roots. Would anyone else like to share?
I don't have anything good for this one.
My very German grandparents.
Very German grandparents. That's always a fun one. I have, my stepfamily's German, so there's lots of really good buttery, creamy food.
Oh yeah.
that could be one of my many roots.
Very intense. Everything is intense.
Yes.
With German families.
So next is the trunk, and kind of the way that a tree grows is through its trunk, and this is where you can think about different skills and abilities that you have that really make you strong. I'm going to kind of go quickly through these, and then once we have this all written, feel free to keep brainstorming or start your craft, whatever feels best for you. And then we can have some time for questions, and then maybe just have a general discussion about resilience and kind of how this all applies. So the next thing is knots, as we were talking about earlier with the adverse childhood experiences. Knots are representing stressors or barriers that you've encountered. And if you think about the knots of a tree, really, I feel like the knots are what make trees really cool and something that gives the trees their character and make them interesting to look at. On lots of hikes that I've done, like in the redwoods or some of the big trees that have like so many different knots that sometimes you can see through the knot, or I think there's a tree where it might be gone now, but you can like drive through this big opening in it. So I think that while these aren't always the most pleasant experiences, I think they really are what gives trees and people character. Anybody want to share any knots or barriers? And it's fine if not, because that's kind of a sensitive.
That one feels a little more personal.
Yeah, it does. I was real vague about the knots that I shared in my sparkly tree. So the next one is branches, and this is a fun one. Your hopes, your dreams, and your wishes for the direction of your life. Next, we have the leaves, and the leaves represent the things that you are grateful for. And the fruit of the tree, I don't know if you're able to see it. Maybe the camera can zoom in, but there's one little tiny lemon on my tree. You might have some stickers of fruits and vegetables that you can put on there. I picked a lemon mostly because I really like lemons. I like how they are sour and go with lots of things, and they also match the yellow in my sun. And then finally, the sun. So this is the daily practices that convey warmth and compassion. Also, it can be like a daily routine that you have for yourself, or something that just is consistent in your life that is a source of resilience or a source of strength for you. And the sky. The sky's not on here since I added it, but the sky is representative of opportunities or, I guess, new horizons that you see in your life. So as we get started putting the tree together, one thing I wanted to mention is in the Zimbabwean tradition of the Tree of Life, they talk about a first story and a second story. So the first story is kind of the objective, what has happened in your life. And then the second story is something that you can use this tree to represent. And it's designed to offer you a narrative way of explaining things that have happened to you with the spin of resilience and strength. And this can help people to enhance their feelings of self-control and self-efficacy. And just taking the time to go through these things and write them down and then spend energy and effort into creating something beautiful really is a powerful tool that you can use to share your strength with others. It's a great activity to do as a family. And then you can hang up your trees and talk about them when things do get tough. And another thing that I'll note is a common theme of the Benevolent Childhood Experiences is that many of them, if you do go look at the scale, there's like 10 benevolent experiences. Lots of them have to do with relationships. And I would say that this tree is also reflective of that. I think that the relationships we make with parents, caregivers, teachers, mentors, when we're kind of in that 0 to 17 range, really do impact the trajectory of our life. I know that in my life, some of the teachers that I had growing up really made a big impact on me. So I think that it's important to think about those relationships. And if you're a parent, to really consider how much of an impact that one relationship has on young people. So that is all I have. If there are any questions or anyone in the audience would like any more ideas or wants to maybe share something from their tree, we can definitely have that in the chat. Or any questions from the audience? Anyone want to share their tree that took you just a few minutes to whip together?
I think it was just a good reflection of what you have in life, to be grateful for it.
Thank you. Just a good reflection to be grateful for what you have in life. Any other questions? Well, thank you all so much for joining us. Is there anything you'd like to say in closing, Amanda?
Yeah. So again, I want to thank everybody who joined us this evening, and I know we talked about some really heavy topics and some really sensitive topics. I think this is how we break the stigma, though. I think this is how we bring these discussions out of the shadows and make it less taboo, because what we've seen in mental health and substance abuse, and something I borrow really heavily from the ACT UP days in the 80s and people living with HIV/AIDS, is that silence equals death. And so the more we can have these discussions, the more we can get comfortable with having them, the less fallout we're gonna continue to see from substance use, suicide, anything that people are traditionally afraid to ask for help on. So just being here is really indicative of how much more people want to learn about this and gain the tools to help combat some of these really big issues. So I want to express my gratitude for that. That's usually one of the things that I think about a lot when I think about how much I like doing my job. And will be one of the branches on my tree is that gratitude piece. I would love for Marta to explain to the folks that are primarily Spanish speaking. So I've been informed that the links I clicked on aren't supported in the live stream, but can be accessed through the slides. So Marta, if you wouldn't mind explaining that in Spanish to our folks at home, and I think she'll probably have to talk into my mic. Is that correct? Okay. So here, you know what we'll do? Is we'll just...
The links are not working?
Well, so the links don't work. When I was clicking on them, I don't know that the people at home could see them, but they'll be able to access them in the recording if I send them the slides.
Lamentablemente los enlaces no pueden ser accedidos en esta presentación, pero ella va a estar proporcionándolas y les va a estar enviando las diapositivas de la presentación, así como los enlaces correspondientes de manera posterior.
Thank you. So yeah, that's really all I have to say is just, again, thank you, everybody. Please don't hesitate to reach out to us with questions or how we can be supportive of you or, the youth and adults in your life. Again, you can shoot me an email, go to our website, bch.org/pillar, go to the Rise Against Suicide website, and yeah, it's a place to start, at least. If we don't have the right answer, we'll connect you to the people that do. Oh, sorry, hold on. One more question.
How are you going to be providing the slides?
Through email. Yeah, so I will be providing the slides through either the email you signed up with, if you would like them, or you can just send me an email directly.
Los enlaces se les van a proporcionar, así como la presentación y las diapositivas, se les va a enviar por correo electrónico. El correo electrónico que ustedes proporcionaron cuando se inscribieron a la clase, ella se los va a estar enviando a ese correo.
Thank you. Any parting thoughts?
Thank you all so much for joining and for participating, and please feel free to reach out if you have any questions about any of the content or the activity. I'll include my email and contact information with the email that goes out with the slides. And if you do want to do this activity again, definitely reach out and we can tell you where we bought everything and offer some ideas for how to facilitate this activity in another group setting. Thank you all so much.
Thank you.